Now, as governments and the Ghana Medical Association continue to haggle over conditions of service for doctors at the country's public health facilities, tax-paying patients are the ones having to bear the brunt.
At the Child Health Department and Maternity Ward of Ghana's premier referral hospital, the Kolebu Teaching Hospital, children who had been booked for surgeries could not be attended to because there were no doctors available. Joy News' Matilda Homaga reports that usually chaotic accident and emergency areas were deserted. An indication the second phase of the doctors' industrial action had been fully activated, as has been communicated earlier.
The second phase of the industrial action by the doctors involves the withdrawal of emergency services. And on Monday morning, it was obvious it has taken full effect at the accident and emergency wards. Ambulances, taxis and private vehicles would have been wheeling in patients with horns or siren blaring loudly. It is, however, almost dead silent. As of Friday, the Child Health and Maternity was still admitting new cases. On Monday morning, however, a notice had been placed at the entrance, barring relatives and patients seeking health care. Some expectant mothers and others who had brought in their children to see the doctor waited, hoping that the doctor would show up.
I got here around 6:30 in the morning, a.m.
Okay, so how was the situation when you got here?
Okay, when we got here, we were told that the doctors were upstage. I'm also worried because we don't know. My son is coming for a surgery and I don't know whether the surgery will come on or not. So we are waiting for our turn. When we get in, then we know the outcome.
I came here last week and the doctor asked us to come this week. I'm worried.
Why are you worried?
Because when we get here, they said the doctors are on strike. So, but they're going to attend to us. But they can't tell when to do the operation.
Okay. Yes.
Yes. And I don't think they're going to do it today.
As of 2:30 p.m. when the news team was leaving, the patients were still waiting, hoping that they would eventually be attended to. At this rate, it's almost certain another set of patients will show up again tomorrow to continue the vigil, for as long as the government continues its standoff with the doctors. Matilda Homaga for Joy News, Accra.
And the strike, meanwhile, is taking quite a toll on the security hospitals which have their doctors at post.
Hannah Odami has been to the police hospital here in Accra, where she reports there's been a significant increase in the number of patients trooping in, but who rather interestingly say they are quite impressed with the level of care being given.
On a normal day, 3 doctors will be in the consulting rooms at the OPD here at the police hospital. Today, however, I realized that all 6 rooms are full because doctors on leave have been called to duty. And we all know it's because of the doctor's strike. This is just one of the measures that the hospital has put in place to avert an overcrowding as a result of the doctor's strike.
We attend Mamobi Polyclinic. But when we went there, they said because of the strike, we should either go to 37 or police hospital, so that's why we are here. Lenda, when you come here, they have to give you quick service, but today, because of the strike, when we went there, they said because of the strike, there will be a lot of people here. So when we came to, we've seen the number of people here, and we have to wait because we need the care. As for the strike, the government should try and do something because we cannot lose our lives because of him. Because he has to try to. We are also important as he is, and I think he has. Mama has a private doctor. Those of us that doesn't have money, we don't have private doctors, so we are also needed. We are also important as he is.
A lot of people are here, but they've just attended to me, and I'm okay. I came around 7:30, but they've attended to me. Yeah.
So you think that the police hospital has done well by putting in?
Yeah, they've done well. And they are attending to the patients very nicely.
The police hospital has 100-bed capacity, 70 for adults and 30 for children. Currently, the maternity ward is choked, and so the hospital has had to extend the maternity ward with extra 10 beds on their corridors